Anyone who believes in indefinite growth on a physically finite planet is either mad or an economist.
We don't want to focus politics on a notion that involves the rejection of principles around which a large majority of our fellow citizens organize their lives.
We are not as endlessly manipulable and as predictable as you would think.
I have the privilege of talking about the question whether chronic conditions are killing the competitiveness. Well, the bad news is yes. The good news is we can do something about it. And that's exactly the vision which Gallup and Healthways had when they teamed up to develop the WellBeing Index to provide our leaders a leading indicator to influence well-being. Okay, you may say, why is that important? So basically what we're doing every single day is make decisions. Consciously or unconsciously, we make decisions. And the question is, how many are we making? Well, it's not one or two. As a matter of fact, we're talking about 10 to 20,000 decisions a day. That's a lot. Now, when you apply that for the UK, that means we have 1.2 trillion decision moments per day. Now, if you apply that for a full year, we're talking about 500 quadrillion decision moments per day. That's a huge number. So the point is, how do we make sure that we actually channel the decision moments and the decisions in the right direction? Because when we're talking about well-being, we're not talking about physical health only. There's a lot of factors influencing the well-being, being it emotions, being it your employer, your financials, your career. So when you make decisions, the question is, on which basis do you do that? And as a matter of fact, you're being exposed to many, many influencing factors. You talk to experts, you talk to your friends, you talk to your family. You're in a certain environment, you're within a certain cultural framework, and obviously you're also exposed to certain policies. All that is influencing your decision. When we talk about the competitiveness, the question really is, how does this translate into economics? When we improve the well-being, it is a fact that we're actually capable of reducing the total medical cost. But that's only one side of the coin. As a matter of fact, we're also increasing performance, because if your well-being is high, your productivity is higher. You're fully engaged in your job. You have less days of absence. And you're actually, while you're at the job, fully committed to making it happen. So all of that translates into increased economic value. And it's very simple. If we don't do anything, over the next 5 years, accumulated cost will be 220 billion pounds. That's the bad news. The good news is, if we channel the decision-making and improve the well-being, there's a savings potential of 220 billion pounds. Why is that? Because if just 1/4 of our decisions are channeled in the right direction, if we reduce the risk factors by 1/4, this is the savings potential we're talking about. Now, the conclusion is, there's a high cost of not doing anything. We know what the sources of the costs are. We know that chronic conditions cause people to seek care, and it reduces their ability to work. It reduces productivity. And we can influence modifiable behaviors to reduce cost. What does this mean for competitiveness? Well, basically, all nations, employers, corporations, societies have the same challenge. The issues are known. The difference will be leadership. We need to be committed to make a change. We need to have stringent execution to make it happen. We should be quick in doing that, because every day which passes without doing anything translates into lost economic value. And obviously, we need to create an alignment. And this is why the leadership across various levels is important. First, we need to talk about the patient and the general practitioner, the healthcare environment. But obviously, it needs to involve also the work side and ultimately the community. The three of them together will make a difference, and the UK has the chance to become very competitive when we get executing on these issues.
The WellBeing Index is a 55-question survey, so it's not just about happiness, and it's well beyond physical wellness, although those are parts of it indeed. But we think that we have a more comprehensive measure of well-being than traditional notions of what well-being maybe is. The 6 domains that we look at are listed here. So there's life evaluation. That's just how we evaluate our lives today and in the future. Emotional health, yes, happiness is a part of it, but so is stress and worry and anger and clinical diagnosis of depression. Physical health includes all of those chronic conditions. Also includes things like self-reported BMI, we get at obesity. The healthy behaviors are very straightforward: smoking, eating healthy, fruits and vegetables consumption, exercise. Work environment, that's a big part of our lives. About 6 out of every 10 UK adults have a job. It's a big way that we spend our lives interacting with one another. And then basic access: healthcare, food, medicine, shelter, safety. All of that gives us, we think, a very, very full-bodied view of what well-being is and ought to be inside of any given society. We think, quite frankly, that if leaders don't understand this and don't act upon this, then it's not really worth doing. And so this is meant to be something that is a drivable force inside of the UK. In a nutshell, only 1 out of 5 British full-time workers are in optimal health. That is, have normal weight and have no other chronic conditions that are encumbering their ability to execute at a high level inside of society. 4 out of 5 do not. There are different ways you can set about thinking about chronic conditions. We split them into 2 things, what we call disease burden and then overweight and obese folks. Disease burden, those classic conditions: high blood pressure, cholesterol, diabetes, cancer, asthma, clinical diagnosis of depression, heart attack. We also get at recurring physical pain, which is a real big one. There are some other things that some will include in disease burden. This is the definition that we use. And yes, while there is some debate, most consider obesity to be a disease, including the World Health Organization. It doesn't really matter to our analysis whether we include obesity as a part of disease burden or not. We kind of stick to traditional approaches of keeping it separate, but the math works out the same regardless. Well, here's the breakdown among full-time workers inside of the UK, and we've split us into 6 non-overlapping groups. So our baseline group is that bar across the top, our normal weight, no disease burden workers. Just 20% of us are at that optimal level of health. If you look at overweight or obese with no disease burden, it's about another 1 out of 5. Overweight or obese now with just 1 or 2 of those other disease burdens, 1/4 of our population. About 11% of overweight or obese that are 3+ disease burden, and then 17.5% normal weight with 1 to 2, and about 5% normal weight with 3+ disease burden. So that's how the proportions fall out as far as the UK full-time working population. Well, one question that's very useful to us is the unhealthy days question. It just reads, during the past 30 days, for about how many days did poor health keep you from doing your usual activities? And we can control for all the demographics in the background and look at the mean number of unhealthy days that each one of these groups have. Our baseline group is up across the top: normal weight, no disease burden. Only about 1/3 of an unhealthy day per month, so they don't miss much work. The other groups, though, it goes up considerably. If you look at just the second bar down, that's your overweight and obese group. No other disease burden. All we've done is add on a little extra weight, and the unhealthy days double. When you drop in the disease burden, though, the numbers climb and climb high, especially when you get to 3+. Then you're up to 5 unhealthy days a month. And that holds whether you're overweight or not, incidentally. There's lots we can do moving forward then from that. We start out by saying, well, what's the economic cost? We're using £209 a day per full-time worker. That's assuming an 8.7-hour day. This is based upon some very good, very frequently cited external scholarly research. One unhealthy day then also translates into about 3/10 of an actual missed day of work. We've tested this inside of both the US and the UK now. So we'll remind respondents, okay, earlier you said you had 4 unhealthy days in the last month. How many days in the last month have you actually missed work? It's a number somewhat lower than that. It's about 3, just a little bit over 3/10. So that's your calibration from unhealthy days to actual missed days of work. We set those 20% healthy folks as our baseline and compare everybody else to that. So we're looking at incremental missed days of work above and beyond what our healthy folks are already experiencing. And then we layer in the extra stuff and add it up. On the left-hand side, those are those same average unhealthy days for each of these health classes that you just saw on that bar chart. The next column over is the actual full-time workers that you have in each one of those groups. So there's about 49 million adults, 18 plus inside of the UK. About 45% of those are full-time workers. And from there, you can kind of carve it up and divvy it out into those 6 groups. And then you can just multiply our total number of sick days. That number doesn't appear here, but it's coming from that first column, to get at the total number of incremental lost work days over the course of the whole year for each one of those groups. And then you multiply that by the 209 pounds. It's very substantial. That's a lot of sand that's thrown into the gears of the UK economy that is indeed affecting economic competitiveness negatively.
It's safe to say we are all trying to have healthy and engaged workforces, again, optimizing health when there is a chronic condition. And all of this does contribute down to a better performing business, a better performing society, and better economic performance and growth. We know that for most people, good work is generally good for their health, and it contributes in a number of different ways, helping to promote recovery and rehabilitation. It can improve the quality of life, as an example, and is usually central to a person's identity and social status. You can see the impact of lifestyle on health and work, the optimal ideal lifeline, and what can happen if you have declining health that progresses on down into chronic disability. You might be surprised to know, and this is from the Foresight report, that predictions estimate that by 2025, approximately 40% of adults in the UK will be obese. And you might also be interested to know that the predictions for diabetes that is related to obesity is up to 98%, which is quite frightening. You can see why people are often off work due to chronic conditions, and some of the reasons include rheumatic disease, musculoskeletal disease, and what they require is good clinical care, vocational rehabilitation, and work-conscious healthcare professionals. And there's often very simple, practical things that can take place in the workplace to optimize them. Positive workplaces enhance well-being and usually have very senior, visible leadership from the top, accountable managers throughout the organization who are trained and understand and know how to respond effectively, and flexible work conditions. As an example, we have a couple of members of my team who have both diabetes and also musculoskeletal disorders. And by having flexible working, our sickness absence rates are quite low. We know that for about 2/3 of chronic conditions, they're often minor, and early intervention can help to prevent sickness absence, presenteeism, and other problems, and prevent chronicity. If you look at the chronic conditions, that's about 1/3 of cases that are more severe and investigations are more extensive. We also know that often there are other problems that may exist besides the actual medical problem. We know, as an example, that if we reduced in the NHS alone the sickness absence rates by 1/3, the cost savings could be upwards to £555 million, which is approximately 14,000 employees. If you look at the impact across Europe on musculoskeletal disorders, you can see the impact and percentages are quite startling. Unemployment rates are 3 times higher among people with musculoskeletal disorders than in the general population. So what action is required? Again, a focus on capacity, on what people can do, rather than focusing on incapacity. Early intervention, imaginative job design, and thinking beyond the physical symptoms. Just a very brief and quick case example. The Port of Blyth won the National Business Awards last year in the small business category, and interestingly, have a very erratic shift worker, male-dominated workforce in a very deprived area. And by focusing and embedding health, work, and well-being into the workplace, they've now had many of their staff quit smoking, reduce obesity, and lose weight, and improve their health behaviors in general. And the knock-on impact of that is that they have gone from having an average of 6% sickness absence rates to last year down to 1% in the 2010 rates. There is a correlation between the socioeconomic factors and COPD as an example. Those in socioeconomic groups are in the lower socioeconomic groups are up to 14 times more likely to have lung disease. And you can see in the standard mortality rate by social status for 3 respiratory diseases. On number 5 category is unskilled manual workers, and you can see they have much higher rates. The cost of mental ill health at work, there are many things that managers can do. And if you look at this example, NICE has set out the potential cost savings. Interestingly, E.ON have done a lot of work in the workplace itself on mental health and have seen a £28 million reduction in sickness absence just by focusing primarily on increasing and improving mental health and reducing stress. This gives you an outline of what potential savings can be derived and how to achieve that. Again, awareness training for line managers, prevention, better access to help, and effective rehabilitation for those who do have chronic problems. Again, these are the outcomes that we're trying to achieve. More people reaching better health in later life with improved personal financial provision and the ability to work if they desire to with enhanced well-being.
I'm going to concentrate on mental well-being because I was chair of the Chronic Disease Global Agenda Council of the World Economic Forum 18 months ago. And of all the chronic diseases, in terms of morbidity, mental ill health and stress at work, stress in general, costs us more than anything else. 20 years ago, I went, NIOSH, the National Institute of Occupational Safety and Health in the United States, asked me to chair their strategy for the United States government on looking at stress in the workplace, because this is what it was costing the American economy over 20 years ago. 10% of gross national product. In the UK, it's roughly about 5% of gross national product. In the EU, depression costs enormous. 41 billion, lost productivity, that's in euros, 77 billion, coronary artery disease, 35 billion. It's expensive, right? Chronic diseases, mental stress in the workplace and for the economy is expensive. It was in 2004 that the CIPD, the Chartered Institute of Personnel and Development, all the HR people in the UK, found in 2004 that mental stress passed musculoskeletal as a major cause. And it's quite interesting how they defined it. They have stress and mental health as separate categories. So 2 out of 3 of the costs of sickness absence in the UK, as judged by HR people, were due to stress, or what we call the common mental disorders of depression, anxiety, and stress. And in every sector. And they're increasing, and that was in 2004. Now, I was the lead scientist for the Foresight Program on Mental Capital and Well-Being for the Government. Prior to that, just before we started in 2008, the Sainsbury Center for Mental Health had the health economists cost up what mental ill health and stress was costing the UK economy. Presenteeism costs double the amount of absenteeism. These are people turning up to work but not delivering. We're not just talking about direct health costs. We're talking about people turning up to work but not delivering added value. This is what it is. Looking at a 2x2 table, right? You have sickness presenteeism, which was Dan talking about. People turning up to work because they're frightened of not turning up to work. And presenteeism in that category now, with the recession and everything else, is massive. Even if you just have the flu, I've got to go into work. I don't want to have, sickness absence on my record. So there's sickness absenteeism. Then there's unhealthy people, not always present. They have diabetes, they have problems. That's, normal. And then healthy, but not always present. They are job dissatisfied people. And what we really want is the healthy and present, the top box. What proportion of people do you think fall in the healthy and present group? What proportion of people in the UK? This is based on 39,000 people, all right? This is horrific. Only just over a third of our people are actually there and producing. You're not going to change too much the health not good category with some absences, because we all have the kind of illnesses. Job dissatisfaction levels 13%. So you're really talking about probably 41% of people in the UK are not functioning. It's great to collect all the figures about how we compare against Germany and everything else. For me, the bottom line is, how do we get people functioning productively and less ill, right? right? That means we have to unpack why they're off ill, why they're stressed at work, why the well-being's inhibited, why they get type 2 diabetes, why they don't eat properly. That is the critical dimension. And this is what Foresight found from all our science reviews. If you look on the left-hand side, identifies what the science tells us in graphic form. For example, the UK has the longest working hours in the EU, other than the emerging EU countries. We've had this for a long time. And if you look in a given week, we even have longer working hours than the Americans have, because the Americans have an average of between 5 and 10 holiday days per year, whereas we have between 4 and 6 weeks. Evidence is clear. Consistently work long hours, you will get ill. Excessive workloads, unmanageable workloads, we know. Lack of engagement, participation, and control over your job. There are tons of studies. And worst of all, the thing that causes the most damage in the workplace are managers. So we have to unpack it, because unless we deal with that, we're not going to change anything. These are just some of the recommendations that came out of the Foresight that were costed up. Flexible working arrangements, science shows, works, affects the bottom line, but only if the flexible working arrangements are made available to all employees and not just those that have children. You get double the benefit if it's open to everybody. That's single people, that's people who have elder care responsibilities. Again, check the Foresight program. Again, managers, very important we do something about training line managers, because they are we hire them in on the basis of their technical competence, not on the basis of their interpersonal or social skills. That is what is causing the lack of productivity, in my view. If I was to pick one thing, that would be it in the UK.